And here, my dear friends, is one more video for you. Don't forget to subscribe to my channel and share with a friend. Genetics. Two types of hair loss. There is a somatic transmission, which is passed from father to son, not through the sex genes, but through the normal genes, okay? Somatic transmission. For example, my father's completely bald, my uncle's completely bald, my brother's bald. Everyone for hundreds of years in my family are bald, and I'm not. How is that possible? And in my case, it was transmitted somatically because my grandfather on my mom's side is full of hair. So there is a somatic transmission, but there is the X-linked transmission, which you're more familiar with, which is transmitted from your mom because her father was bald. Okay? So if your mom's father, your grandfather, was bald, you will have a very good chance of being bald. If your father was bald, you also have a very good chance of being bald. Let alone all conditions which are not genetic, such as alopecia areata, alopecia universalis, which are autoimmune, you fighting yourself. It can be as simple as stress, or it can be dietary, or unknown etiology, unknown, okay? So there is a whole spectrum of causes of baldness. Luckily, most baldness is genetic, and that is what we're going to hit on. Of course, always consult with a dermatologist. So we talked about the ways the hair loss can be perpetrated. Now let's talk a little bit about how we can treat it. How we can treat it. For men, very, very simple. For men, there are only two treatments, medicinal, and one invasive treatment, which is short of surgery. I have it here in my hands. Minoxidil was discovered, I don't work for this company or anything, is topical. So what's causing the follicle to shrivel and the hair to become progressively thinner and thinner until it's no longer visible? Dihydrotestosterone at the follicular level. So we tried in medicine to attack problems from different ways. For example, when I take you to surgery, I'm going to give you 5 anti-nausea medications, treatments, which attack you from different sides. In other words, we want to attack the problems from many different ways: chemical, mechanical, surgical, etc. Okay? So we can use a cream called minoxidil, which blocks dihydrotestosterone. It has a vehicle which lipophilic, which penetrates the skin and helps block dihydrotestosterone. Systemically, we use finasteride. One company is called Propecia. So Propecia, which is finasteride, blocks dihydrotestosterone systemically through your arteries, okay? Women cannot do finasteride, especially pregnant women, okay? They cannot. It will cause severe problems, can cause severe problems with the development of the fetus and in the woman herself, okay? So we do not do that. All right, side effects. Let's touch on the side effects very quickly. There is a spectrum of side effects, as with even aspirin. However, the one people are most concerned about is the impotence, okay? So, of course, these are strictly methodically tested drugs. And it has been discovered that at 1 milligram, which is the dose given, these sexual problems, which is erection problems, decrease in desire, and so on and so forth, are not an issue, okay, or much less of an issue. However, at higher doses, it is an issue. So, as usual, follow the instructions of your doctor, which is 1 milligram per day. Say there is an error, accidental error in dosage, forgot, took extra. Studies have shown that upon cessation of taking finasteride, these problems are reversible. Okay, I've taken it all my life, and my gosh, all my life, at least 20, 25 years, and I both products. And I have a very beautiful family, and it's not been a problem, and it's not been a problem. And I know many people in my world who take it, it has not been a problem. Okay? Best people to prevent. Okay? Best to prevent. So if you have the genetics, I would consider start taking it before you lose your hair. Okay? Much easier to maintain it than to regrow it later on. Okay, so Dr. Ray, finishing this little segment on alopecia, hair loss. I love you. I want you to look good. Please take care of yourself.